Hi, my name is Eric Block with Saladax Biomedical. Thank you all for attending tonight's presentation. We appreciate you spending the time with us, and we're excited to see so much interest in this topic. The title of tonight's presentation is Customizing Chemotherapy, a Personal Approach. On slide 2, we have an overview of tonight's presentation. I'll do some brief introductions, then turn things over to Adrian, tonight's presenter, who will talk about what's wrong with the way we dose chemotherapy today, a better way to manage chemo dosing, the impact of better chemo dose management on your treatment, and lastly, what is the My5FU test and how does it work? We're hoping to leave lots of time for questions at the very end. Please enter any questions you have into the chat part of the webinar, and we'll try to address them either as we go or at the very end of the presentation. There's also a way to virtually raise your hand, and so hopefully we'll be able to allow for audio questions over the phone as well at the very end. We do ask that if you have questions specific to your own personal situation, either save them for the very end or we'll include resources at the very end on how you can contact our partners at the Colon Cancer Alliance or Saladax Biomedical directly with any very specific questions.
So first tonight, I'd like to introduce Martha Raymond. She is the Patient Support and Outreach Director at the Colon Cancer Alliance. We've partnered with the Colon Cancer Alliance for activities such as tonight's presentation and so many others, and it's been absolutely wonderful. They are a great organization, very helpful, and we are very excited to be working with them. Martha and the staff of Patient Navigators are out there helping people every day, and it's wonderful. I know a lot of the Patient Navigators are on tonight's call as well. In addition to the representatives from the Colon Cancer Alliance, several of the Saladax Biomedical staff are online, including myself. And Adrian Choma, the co-founder of Saladax Biomedical Incorporated, is today's speaker. I'm going to let her introduce herself in a moment, so if you hang on while I try to pass control to her and get her on the line.
I'm very pleased to join with you today for this session, and I can't tell you how excited I am to have the opportunity to speak to you today about personalizing chemotherapy dose management. As Eric said, I'm one of the two founders of Saladax Biomedical. My partner, Sal Salamoni, and I have long-standing careers in the diagnostic field, and Sal has developed close to 80 tests, many of them in the drug monitoring field. So you should feel confident in the quality of the tests that we offer. I'm also a breast cancer survivor, so I can personally appreciate how MyCare can make a difference to cancer patients. So just a few words about Saladax before we get into the My5FU test. We now offer 3 simple blood tests that measure the blood level of specific chemotherapy drugs so that doctors can customize dosing to individual patient needs. We offer tests for 5FU, which we call My5FU, which is primarily used for colon cancer, colorectal cancer, as well as now offering the mypaclitaxel and mydocetaxel tests that are used for multiple other solid tumors. We're also developing an additional 10 tests, and we'll be launching the myimatinib test for CML this summer. So that's just by way of background. So let's get started talking about chemotherapy dosing and the focus on 5FU. Eric, next slide, please. Okay, dosing chemotherapy can be very tricky because it needs to be just right to get the best treatment results. If the dose is too low, the cancer is more likely to return. If the dose is too high, you can suffer intolerable side effects that require chemo holidays, interrupting your treatment, and some toxic side effects can even cause damage that lasts a lifetime, impacting quality of life even if you beat the cancer. Next slide. So how is chemo dosing determined today? Most cancer drugs are dosed based on BSA, or body surface area, which is simply a mathematical formula based on your height and weight. I'm sure you're going to be surprised to learn that this BSA formula was first devised just about 100 years ago, and it was based on the study of only 9 human subjects. The intent of the formula was to translate drug doses tested in animals to human dose scale. And when chemotherapy was first introduced in the 1950s, BSA was used as the dosing standard because there was no better option at the time. Next slide. But as we all know, there's been a lot of progress in the medical field since 1916 and even since the 1950s. We now know that there are many factors that influence how we absorb and clear drugs. And it's similar to other substances that we ingest. For example, Eric can eat pizza, burgers, and milkshakes and not gain an ounce. I'll look at a pizza and gain 5 pounds. On the other hand, I can drink a couple of glasses of wine and not get a buzz, while the room would be spinning for Eric. And it's the same with drugs. There are many factors that work together that result in how much of the drug we actually stays in our system to act on the cancer. And here on this chart, you can see some of those factors. And they're multiple, and these aren't exclusionary. There are many. Next slide. And as a result of these many factors, different patients will have different drug levels for different periods of time. And this variability from one patient to another can be higher than tenfold. That means if you and I both get the same amount of 5-FU based on our body mass, I may have 10 times more or 10 times less drug in my system than you do. And this is not true only for 5-FU. This has been demonstrated in many studies with many cancer drugs. And obviously, this variability is not a good thing. Next slide. So Saladax is now offering a better way of determining chemotherapy drug dosing by actually measuring the concentration of the drug in your bloodstream and adjusting the dose until it's in the optimal range. And that optimal range is where you get the best treatment results with the least and most managed toxicities. And this practice of dose management is not new in the medical field. It's been used in other areas of medicine. Drug monitoring is used routinely with anti-epileptic drugs, with transplantation drugs, and some serious antibiotics. And it's used typically where drugs have a narrow therapeutic window, meaning the dose that's therapeutic is very close to what is a toxic dose. And that's certainly the case with chemotherapy drugs. So with dose management, we get the drug concentration to the optimal level, which enables you to stay on your treatment because you're not suffering from toxicity, with a better quality of life, and the results of treatment are better because there's less underdosing. Next slide. And this slide just graphically illustrates what I just said. Getting to the optimal therapeutic range is the goal, and MyCare and the My5FU test will help patients reach this goal. Next slide. So how does My5FU work? Once you're on 5-FU continuous infusion, which is typically for 23 or 46 hours, your blood sample is drawn 18 to 44 hours after the start of infusion. Your doctor's staff processes the sample and it's sent to us at Saladax Labs in Bethlehem, Pennsylvania. We process the test and the results are sent back to your doctor typically within 24 hours. The target range for 5-FU concentration is 20 to 30 mg times hour per liter. So let's just focus on the number 20 to 30. If your 5-FU concentration is lower than 20, the dose is increased in your next treatment cycle. If the concentration is higher than 30, then the dose is decreased. If adjustment is needed, it may take 3 cycles of testing and adjustment to get you into the target range. If the initial test shows that you are in range, in the optimal range, no follow-up testing is needed, but it's recommended that you get monitored every 3 cycles or so to make sure you're still in range. So that's how it works, and I'll show you a little more detail on that later on. Next slide, please. So now I'm going to run through some charts and graphs from clinical studies and just point out the key points because it can get a little complex. But I want you to see that these are all based on real clinical data. So I told you that many patients don't get the right dose of 5-FU, but you will be surprised to see exactly how many. On this chart, you can see the target range of 20 to 30 delineated with the dark lines. Each of those little diamonds represent one patient who was dosed with 5-FU by body surface area, the standard today, and then tested at 22 hours after the beginning of their infusion to see what the actual concentration of the drug is in their system. You can see that it's only about 30% of the patients who are in the target range. The majority of patients are underdosed and some are overdosed. And Eric, maybe you can move your cursor to show where well, it's indicated anyway, so it's not that hard. The underdosing is the most scary because neither you, the patient, nor the doctor can tell when you're underdosed. If the patient is overdosed, then you will certainly feel the effects and your doctor will reduce the dose. But if you're underdosed, this can't be observed and you don't know it. So it's the silent killer. Next slide, please. This is another study that shows the same kind of results in a different way. Here there are 2 groups of patients. Arm A is the BSA, the standard dosing arm, with the gray box. And you can see that the majority of patients got 1,500 mg per meter square as their dose. That's the, the tall bar here that you can see about 83% got that dose because that is the standard. The other group, Arm B, get their first dose by BSA and then they're tested and their doses are adjusted to achieve the target concentration in their system. So you can see, and Eric, again, you can point out that the variation in dose among the individual patients to reach that target range was from 900 to 3,300 mg. And you can see that the majority of patients, this illustrates that 68% of patients needed an increased dose from that standard and 17% required a decreased dose to get into the optimal range. Next slide, please. Similar chart from another study, and this one was done with FOLFOX, which is the most popular regimen for colorectal cancer in the U.S. today. In this study, 50% of the patients were underdosed and 30% were overdosed. Only 20% of patients achieved the target range with BSA dosing. And what this chart shows you is a group of patients who were tested and had their, had their 5-FU dose adjusted over 4 cycles of treatment. So there are these are the same patients over a period of about 2 months, getting treatment every 2 weeks. You can see that after the first dose of 5-FU by BSA, very few patients are within the target range. Gradually, over 4 cycles, the majority of patients do achieve target range, and that's the goal. That's the objective in order to give you the best treatment. Next slide, please. But the real question is, and the proof in the pudding is, what's the difference? What difference does it make to you if you are in the optimal range? And this data comes from one of the 2 studies we just looked at earlier, where the majority of BSA dosed patients were out of range and wide dose adjustments were needed to get them into range. Here we look at treatment outcomes, specifically response, which is whether the tumor shrinks after chemo treatment, and survival after 1 and 2 years. You can see that those patients who had their dose adjusted, which is the purple bar, had significantly better response. In fact, it was nearly double that of the BSA group. 34% had positive response versus only 18% with BSA. And survival at 1 year, and keep in mind these are metastatic colorectal cancer patients that these studies are done on, increased from 49% to 68%, almost a 40% improvement for patients whose dose was adjusted to achieve target range, and from 13% to 28%, more than double at 2 years. These are really significant improvements in treatment outcomes, not typically achieved even with new drugs. Next slide, please. Similar results are seen in the FOLFOX study we looked at. Response went from 46% to 70% with the dose adjustment, and progression-free survival, that is how long before the cancer recurs, went from 10 to 16 months, and overall survival increased from 22 to 28 months. 6 more months of high-quality life given to just a simple blood test. Next slide. This slide compares survival data from several FOLFOX studies, and it can be a little busy, but I think it's worth going through. So the first 2 bars are from 2 different studies of FOLFOX and what the median overall survival is with the FOLFOX regimen. So you can see it's 16.2 months to 19.6 months, and the cost of the drugs for FOLFOX annually is approximately $60,000. Now it's becoming very popular to add Avastin or bevacizumab to the FOLFOX regimen, and you can see that gives you 1.5 to 3 months extra life, but look at the increase in costs. It goes to over $107,000. The last chart, and this is a build, Eric, so you can tap it again. The last one is just FOLFOX without the bevacizumab, no Avastin, but with dose management, with a My5FU test. And you can see here, as we saw before, 6 extra months of life, and with an incremental cost from the basic FOLFOX of just about $3,000. So we can see that My5FU can really impact survival for colorectal cancer patients. But what impact does it have on toxic side effects? Are patients surviving longer only because they're getting higher doses and sacrificing their quality of life? Well, let's take a look. These charts are, again, from the same 2 studies we've been discussing. On the left-hand chart, you can see that with BSA-based dosing, the standard today, 18% of patients suffered serious, that is, grade 3, grade 4 diarrhea, the most prevalent toxicity associated with 5FU. When dose was adjusted to achieve target drug concentration, diarrhea went down to 4% of the study subjects. Hematologic side effects like neutropenia and thrombocytopenia were eliminated. In the FOLFOX study, which is on the right, you see similar results. Diarrhea was reduced from 12% to 2%, and in this study they measured mucositis. That went from 15% to 1%. And remember, these results were realized even though most of the patients in the dose-adjusted group had their doses raised. Remember, we said that the majority in these 2 studies, 68% and 50% of the patients were underdosed. So they did get more 5FU. And they still, as a group, suffered lower toxicities. So the goal is to get the dose just right, high enough to be most effective, but not too high as to cause toxic side effects. Next slide. I know that this has been a lot of science to cover, but I think it's important that you have confidence that what we say is backed by real clinical evidence. The take-home message is that getting the My5FU test can make a big difference for colon cancer patients. Getting the 5FU dose just right is important, and most patients do not get the right dose today. With My5FU testing and dose adjustment, you can see improved outcomes, suffer fewer and less severe toxic side effects, resulting in an improved quality of life. And these results are achieved cost effectively, which is of a growing concern in our healthcare system. Better cancer care with a focus on the patient delivered in an efficient way. That's our mission. So now I'd just like to spend a couple of minutes to talk about the support materials that are available to you and the resources. So what you can find on our website, and we'll give you the website in a minute, is first a patient-doctor discussion guide. This test is relatively new in the marketplace, so there are still a number of physicians that are not aware of it. And this guide gives you some questions that your doctor may ask or some issues that he or she may raise and how you can handle that discussion. It gives you more background on how to ask for the test. You can also order the blood sample collection kit. It'll be delivered to your home, and you can bring it with you to your doctor's appointment before your chemotherapy. And you should read the brochures that come in this collection kit. And then we have a brochure actually that you can order that will you can share with your doctor, and a return appointment card that gives you the time, the window of time based on when you started your infusion that you should come back to have your blood drawn. Next slide. And then we put together this Steps to Better Cancer Care that tells you exactly how the process works. And we'll go through this. This is difficult to read, but we'll go through it on the next slide. First, you order your My5FU test sample collection kit from MyCareTest.com, and you bring that to your doctor, read the brochures before your appointment, download the patient-to-doctor discussion guide to help you prepare to talk to your doctor, and then ask your doctor to use the My5FU test and give your doctor the kit to review. Once the doctor agrees to order the test, you start your 5FU chemotherapy infusion, and then you return to your doctor's office between 18 to 44 hours after the start of your infusion, depending on how long the infusion is, whether it's the 22 or 46 hours. It should be at least 2 hours before the end of your infusion. And that's when your blood sample will be taken. Your doctor's staff will send the sample to our laboratories in Pennsylvania, and your doctor will get the results within 24 hours. And based on these results, your doctor will determine whether your level is too low, too high, or within the optimal therapeutic range. And it'll guide him or her in determining what your next 5FU dose should be. If you need a dose adjustment, your doctor should order another My5FU sample collection kit, and then we go through the same process. And as I mentioned earlier, if you're significantly out of range, it could take up to 3 tests and dose adjustments to bring you into the optimal therapeutic range. So this gives you the step-by-step on how it's really a simple blood test that can really impact the success of your treatment. Next slide. And this is what the test report looks like that will go back to your doctor on the left. I know it's hard to read, but I'll just point out the significant areas that would be of interest. The doctor has to submit information on what dose you were at, how long the infusion took, when you got off the infusion, what your actual dose was, and that's reflected in box 1. And then box 2 shows you how we graphically illustrate, in addition to giving the doctor numerical results, we graphically illustrate where you are within the range of 5FU over the course of treatment. So you can see this as an example. The patient was tested 4 times. In the first 2 cycles, they were somewhat below and then less significantly below the target range. And in the second 2 cycles, just within range. So your doctor will have a record and a picture of where you stand through the course of your treatment. And the dose adjustment is based on this algorithm that you see on the right that was published by a prominent investigative group here in the United States that shows that, as you can see, the 20 to 30, no change needed. And then depending how far you are from that target range, you can see the dose adjustment recommended is between 20 and 30%. There's never a very drastic change in dose. That's why it may take more than one cycle, but it's a more prudent way of approaching it. That's my presentation. Eric and I welcome any questions that you've submitted. And here you can see, you can visit bettercancercare.com to get your collection kit. And we look forward to answering your questions, either whether it's today or whether you have follow-up questions privately. Thank you very much for your attention.
Thank you very much, Adrienne. Again, I'll point out the Better Cancer Care website that has additional contact information if you'd like to reach out to us for more information. And I would also like to thank our partners at the Colon Cancer Alliance on this. You know, it's a great organization, the oldest and largest national patient advocacy organization dedicated to colon cancer. And they also have a website and a helpline that you can see here if you're not already familiar with it. And they are very familiar with this concept of PK-based dosing and personalized dosing for 5FU, and can help answer some of your questions as well.